Warm greetings audience. So today I am going to talk about the goniometry for elbow joint. For that we have to know about the goniometer. So a goniometer is a medical device that is used to measure the range of motions in joint. It helps to assess flexibility, mobility and joint function. The key features of goniometer is angular measurement that measures the degree of movement in joint, and it also helpful in accurate assessment that provide precise measurement of joint range of motions. The uses for goniometry are injury evaluations, rehabilitation and research. For injury evaluations, it helps to diagnose and monitor joint injuries or conditions. For rehabilitation, it tracks progress and guide treatments plans. It is also useful in research, as I have said. It is used in studies to measure joint mobility and flexibility. So for now audience, I am going to show you are seeing the research papers on related to elbow joint. So this studies joint focuses on high school baseball pitchers and look at a specific angle in the arm called the carrying angle. The carrying angle is the natural outward bend at the elbow that helps the arm swing without hitting the hip. These studies have shown that professional baseball pitchers often have a larger carrying angle in their throwing arm because of repetitive throwing. However, no one had really studied this effect in high school players whose body are still developing. So this research aimed to compare the carrying angle between the throwing arm and non-throwing arm in high school pitchers. So in this we can also use the goniometer to measure the carrying angle, the baseball that is causing the pain. So that is all about the research paper on this carrying angle.
As you all see, the research papers. So for now, I'm going to show you some book chapter of this topic. So for now, you are saying book chapter of goniometer. As you can see, the goniometer is an instrument that is used to measure the range of motions of train, and the goniometer has four parts: fulcrum, moving arm, stationary arm, and the body of the goniometer. The types of goniometer are universal goniometer, gravity-dependent goniometer or fluid goniometer, pendulum goniometer, and electrogoniometer. So for now, I'm going to show you all the case study of a goniometer.
Okay, with flexion of the elbow, I'll have my patient flex her elbow right here. I got 148 degrees of active measurement. And then I'll put her in passive and I got 156. And then I'll just go straight into extension from here. And she is lacking.
Audience, you are seeing the elbow flexion of using the goniometer. So in this, we have to put the goniometer in an accurate way so that we don't get any errors. We have to put fulcrum into the olecranon process of elbow and the ulnar sterile process in moving arm, and then uh, the stationary arm should be pattern process as reference.
16 degrees with her active measurement. And then with her passive, she's lacking 13 degrees. Fulcrum is lateral epicondyle, stationary arm is acromion, and moving arm is radial styloid process.
As you will see the goniometer, the case study of goniometer. So for now, I'm going to show you the live video of goniometer.
Hello audience, so today I am going to demonstrate the goniometry of elbow. So for that we have to know about the goniometer. So this is the instrument. Goniometer is the instrument that is used to measure the range of motion of the joint. So talking about this part, this one is fulcrum and this one is moving arm and this one is stationary arm and this one is the body of the goniometer. So for now I am going to show you all how we measure the range of motion of elbow, flexion and extension by the use of this goniometer. So, to measure the elbow flexion, the patient position should be in supine position and therapist position should be beside the patient, and we have to place the goniometer in accurate way. So for that, this fulcrum should be placed on this lateral epicondyle of humerus, and stationary arm should be in acromion process as reference. So can you please flex your arm? We have to take this lateral styloid process as reference. As you can see, here is the accurate range of the motions, that is 150 degree. For now, I am going to perform the extension of elbow. So for that we have to put some clothes here so that we don't get any errors.
And we have to place the fulcrum into this lateral epicondyle of the humerus, and we have to put this stationary arm towards the acron process as reference, and moving arms should be in this lateral staggered process. As you can see, we get accurate 0 degree for this. For observation, we have to check whether the patient range of motion is abnormal or not. If the person's range of motion is beyond that, then there is some deformity and we have to care for that. So that is all I want to convey about this goniometry. Thank you.
Audience, I hope you all are clear about this particular topic. So at the last, I would like to conclude by saying that a goniometer is a precise and reliable medical device used to measure the range of motions in joint. Its ability to provide accurate angle measurement, making it an invaluable tool for assessing flexibility, mobility, and joint functions. By utilizing goniometer, healthcare professions can effectively diagnose and monitor joint injuries or conditions that track progress in rehabilitations and develop targeted versatility and accuracy have made it a stable in physiotherapy, sports, medical, and orthopedics, ultimately opportunity to improve patients' outcomes and enhance quality of life. Thank you.